let's talk a little bit about the body itself. And if I usually at work have a nice big cup, empty cup here, but I will show you. So basically, we are vessels. We are vessels as creatures, as humans. And when we're born, we even have a little bit of things that get dumped into us because of our parents. So whether mom had some old strep infections or some old trauma herself or dad did, and then we start to accumulate. So maybe at age 4, you fall off your bike and you're learning how to use training wheels and you skin your knee. People don't talk a lot about there's an emotional trauma that comes that's just as substantial, if not more, than a physical trauma. And then there's a couple bouts of strep throat. And then maybe the person got vaccines and the body rejected it a tiny bit. And then as it continues to fill, there maybe a grandparent passes away. And then they get mono entering college because there's been a high Epstein-Barr virus load, which we'll talk more about. And then we spill over. And when that cup spills over is when usually we see a breaking point where we then see this unusual rash that the body has, or these horrible digestive issues, or maybe the person finally gets diagnosed with Lyme disease, but the bite didn't happen when the cup spilled over. It happened earlier on, and the body did its best, as it should, because the body is brilliant. That is our tagline. And that immune system kicks in constantly until it can't. And now you have an infection load that's high, an emotional load that's high, a dysregulated nervous system that's high, hormones that are imbalanced, and this immune system is just underwater. So this imbalance is what creates dis-ease or symptoms that manifest into who knows what. And that's where I have a tough time at times with diagnosis or naming a certain condition. We've had to do that in Western medicine. And I can sometimes bash it a bit because I'm an occupational therapist, so I've lived that life, is a lot of times a diagnosis is put on in order to give a medication. And we do have diagnoses like seasonal affect disorder and irritable bowel syndrome and things like this that are a little bit more vague. And there's a medication that someone could be put on to help that. But we are root cause. So the whole idea of this cup analogy even is to get down to empty that cup, like work on those infections, work on those traumas, put voice to them, start to guide the body to clear it itself. That's what we do. And then that's where we start to see symptoms dissipate, where people have been to so many practitioners and medical facilities. And there's some movement that happens.